With respect to postgraduate education, I've limited the number of courses that I've completed since dental school. This was mainly because I was looking for a comprehensive course on restorative dentistry. I was obviously aware of the FGDP course and started looking at it since 2015, but it was until 2016 that I applied. This was because mainly I did a bit of research on it and I wanted to make sure it was right for me. So the course involves various teaching elements. Firstly, on a Friday, mainly Friday evenings, you get a multiple short answer question examination, and then you have tutor groups in which you are split up into groups of 4 or 5, and then you discuss with your colleagues and you tutor various cases that you've seen in practice. And these are really important because it's where you learn a hell of a lot from various individuals, and you can learn from your mistakes and their mistakes as well as their successes. And this has been one of the most important parts of the course for me, and where I've found that we've been able to implement the things taught in the study sessions and bringing them into our clinical practice. The sessions with the dental tutor on the Fridays was one of the most important parts of the course. I was privileged to have a restorative consultant as my tutor, and our group was fantastic in drawing from everyone's learning experiences, both good and bad, and we learned a hell of a lot within the 3 hours or 4 hours that we spent talking to each other about cases. We could talk about a radiograph for an hour to assess whether or not a root filling had worked or whether or not a re-root treatment would be an option. But we also did more complicated cases such as tooth wear and more complicated fixed removable prosthetic designs. I think the most important part of doing postgraduate education in dentistry is actually implementing what you're taught straight away when you return to clinical practice, because if you don't implement the skills and the knowledge that you're taught, you've wasted that investment in yourself. So I was very enthusiastic to do that, and therefore I bought an articulator and a face bow, and I started to use those straight away. As soon as we were taught about them on the course, I was bringing those into my clinical practice, and now they are used routinely for my work. So without doubt, I feel that the FGDP Restorative Diploma has really had a positive impact on my clinical dentistry, and this therefore is translated into my patients benefiting as well. I'm now providing dentistry to an even higher standard with the tools necessary and the knowledge and experience necessary to use them to be able to safely provide more complicated treatment for my patients. So the FGDP course is comprehensive in its design. It is distance learning, which was appealing, being as I was full-time in practice, but it was also set across a Friday and a Saturday, a Friday evening and Saturday day, and occasionally a Friday day as well, which was very useful being full-time in practice. It is as I said, a comprehensive course. There are lots of skilled and knowledgeable tutors on the course, as well as the external tutors that come in and teach us. Overall, it's been a fantastic course.